the presentation will be recorded, so anybody that wasn't able to make it can see the presentation. I'd like to welcome two client services managers from WorkSafeBC that specialize in return to work. They're part of the Consultation and Education Services Department. Both Teresa and Elise have extensive experience in this topic, and I think we're quite happy to have them do this presentation for us. If you're interested in more in terms of their specific bios, it is included on the Teams meeting invitation that you have. You can read some more there. And I'd like to hand it over to Elise and Teresa so we can get going here.
Awesome, thank you. Just before we begin, welcome everybody and thank you for having us. Both Teresa and I are here in Richmond, and before we begin, we'd like to acknowledge that we're privileged today to be on the traditional, ancestral, and unceded treaty territory of the Coast Salish peoples, including the Musqueam, Tsleil-Waututh, and Tsawwassen nations. My name is Elise Kovalansky, and I am a client service manager, but I'm also an occupational health nurse. And most of my career in the past 25 years as an occupational health nurse has been focused on return to work and disability management. What we do in return to work and consultation and education services, both Teresa and I work with employers like you, helping them with the return to work programs, setting up best practices, and getting better return to work outcome. I'll hand it over now to Teresa, just so she can introduce herself.
Hello, everyone. I'm really happy to be here today. My name is Teresa Chung, and I am a client service manager with WorkSafeBC. My background is in vocational rehabilitation and in law. I've worked as a voc rehab consultant for WorkSafeBC and also other organizations, and am currently now in the consultation education department. Again, it's good to be here.
Thanks, Teresa. Thank you again for having us. This session today is going to be about collaborative return to work and early active rehab. And I'll explain that a little bit more when we get into it. What do I mean by that? But these are the two strategies that set us up for the upcoming Bill 41. So these are the two most important things. We have rejigged our slide deck from what we originally thought we're going to do. There is some new information about Bill 41 that we will add to the end of this, our usual speaking notes that Teresa will inform you on, all the stuff that's just hot off the press. Please feel free to put up your hand. I have mine set up right now where I can't see people, so I'll have to rely on Tammy or Teresa to say, hey, there's a hand up. Please feel free to shout out, ask questions. If we are running short of time, we may ask you to hold them at the end, just so we make sure that we get through that Bill 41 stuff and you have time to ask questions about that. So as we move forward, what we encounter all the time going into employers is something that we call the waiting game, and which is also the blame game. And when it comes to an injury and return to work, what we find is people are waiting, employers are waiting, workers are waiting to see the doctor to get a note, waiting to see if the doctor approves of return to work, waiting to see if WorkSafeBC allows a claim, waiting to see if the employer, the worker, ends up in a rehab program, waiting. There really is no need to be waiting for anything. The time is now. Early intervention, get involved at the time of the injury is the key. 62% of our claims in BC through WorkSafeBC are sprain strains. Those are the easiest ones to tackle, the ones that we can have the biggest impact. And if it takes WorkSafeBC on average 21 days to adjudicate a claim, if it takes on average a week to 2 weeks for somebody to get in to see their family doctor, that's way too long. Recovery guidelines for things like sprain strains, usually full recovery is expected around week 3. So we don't want to wait until week 3 to get started. Some of the key things to break down this waiting game is, again, early active is getting involved early active rehab, and collaborating right from the time of injury. We have this infographic, something that we use regularly, just kind of to break down the return to work process, because sometimes it can feel quite complicated. But really, if we look at the very middle of the picture, the key people are the injured worker and the supervisor. Those are the two that will make or break the return to work. In addition to that is somebody that we might call a return to work coordinator. And not all organizations have a return to work coordinator, but they usually have somebody that's designated for that duty. That three-way triangular role is everything. The return to work coordinator supporting the relationship between the supervisor and the worker. That is the key and the basis of everything. Early intervention and early identification, what we mean by that is you need a process in place, a good reporting process in place, in order to be able to do something and provide the next steps for that collaboration. So if you don't have a process, you're always getting notifications from WorkSafeBC that a claim has been started. There's something wrong in that initial process. That means you don't have the earliest opportunity of getting involved and starting to manage and direct that return to work. When I mean by intervention, what I'm looking at is not only offering modified work, yes, but also other supports, communication, telling people what to expect next, directing them to the next steps, to calling WorkSafeBC, filling out their Form 6, whatever it is. That is still considered support. And when people are injured, they don't always know what's expected of them for next steps. So this is a really good opportunity for that. The other thing that we include in here is early active rehab and referrals to physio. And I'll talk a little bit more about that, why the physio is so important with this collaborative stage, because of all the, the different benefits that a physio would provide. Modified work offer. When we say modified work offer, what we mean is at the time of injury or same day next shift is offering modified work in writing. I know a lot of you guys, when I looked at the list of employers, we've seen your names. I know some of you have some really great programs in place. Keep that up. It's super important to make sure that we don't just do one modified work offer at the time of injury. If that's not working, then we do another, and then we do another, and we keep looking for that earliest opportunity to keep people connected. That's the purpose of a modified work offer. As we move along, if somebody needs light duties, modified duties, suitable duties for more than just a few days, we look at return to work planning. And that is more of instead of a stagnant, I come into the workplace, I have a few duties, I'm sitting in the back room doing WMIS and relearning things. This is more progressive, more rehabilitative. It is getting somebody from zero back to full and regular duties. Sometimes by this point, if the skills and abilities aren't within the employer, the return to work coordinator is not a person that can write a return to work plan, then that's an opportunity for us, because by now we should be involved in the claim at some point to help with that return to work planning and progressing them back to full. When we get involved, if nothing has been done on the claim, we start from the beginning. We start at zero. Let's start investigating. Let's see what's available. If something is started already in the first day or the second day or shortly after, then it's much easier for us to pick up the ball and run with you, as opposed to starting from scratch. And then the final piece, and this is one that gets missed. WorkSafeBC says, bye, see you later, claims closed, all done. But the fact is we don't send people back to work where they're pain-free. Sometimes they may be deemed as functionally capable of returning to work, so they have full function, but it doesn't mean they're feeling great or they are pain-free. So this is a really good opportunity. And where we see a lot of problems is people come back to work. They have, especially with sprain strain type injuries, they have good days, they have bad days. And on those bad days, it seems overwhelming and off they go back off of work. What we want to make sure that people are doing, as much as we're not there to enforce or manage with you, is to make sure that part of your process includes regular follow-up after they've returned to full and regular duties. This is an opportunity to keep them connected and not be disabled and go off of work and incur more time loss. So this is when we're talking about return to work process. These are the key points that we're looking at. Collaboration is absolutely vital in that return to work process. If it wasn't for the role of the supervisor, the injured worker, and the rapport and the relationship, the return to work will inevitably fail. There's so many stories that I know Teresa and both of us have had where employers and workers have terrible relationships. It gets very nasty with the return to work. There are some pitbull employers and, and likely also in return, workers that aren't very cooperative. And that creates issues with the return to work in the long run. It actually causes delays. We find that when people collaborate, the communication improves. There's an increased flow of information. People know what's going on. We know what's going on, so we can help. There's an increased built-in rapport, trust, and relationship. And that all leads to increased participation on the worker's end. What we want to start doing is looking at collaboration to change the disability mindset and put it into more of an ability mindset. And when people are injured, they don't want to, if they're not feeling supported or collaborative, or they're not a part of the process, they feel alone, they lose connectivity, they don't feel cared for, and they feel overlooked. An injury quite often is not just happening to the individual, it impacts the rest of the business. Benefits of return to work are the same as benefits of collaborative return to work. When the employee has a supportive supervisor, because again, that's the key role. That's the person that's there at the time of injury. Sometimes the return to work coordinator is 9 to 5, Monday to Friday. If you've got around the clock, it's the supervisor that can make or break and make the difference. When people are feeling supported, it decreases their financial impact, keeps them connected to the workplace and their coworkers, and it gets them into that more of the ability mindset that increases their sense of self-efficacy and self-confidence. That they feel stronger in when they're supported, that I am going to get better. I can do it. Look, I am doing it. On the flip side, for the employer, what's really important is when an employer, an injured worker, feels that they're being supported by their supervisor, they view the employer as being supportive. People usually don't leave employers, they leave their supervisor. And that's really important to remember. So when people are feeling connected and feeling supported, it makes them feel that they are being valued. It helps the employer maintain their productivity. It retains their skilled workers. That retention is super important these days. And of course, the most important piece, quite often, is it reduces premiums. So again, we want to get involved as early as possible, keeping people connected. We all know 1980s studies say the longer people are off of work, the less likely they're going to return. What we know now to this day, it used to be 50% at the 3-week mark. The last research that we saw actually was in 2015 out of Australia. It said 45 days. 45 days is the magical number. So if somebody is not connected to the workplace in 45 days, that's when problems occur. And what that means is 1 in 3 people are going to have marital problems, or may actually 1 in 3 also have an additional disability that appears. 1 in 4 have financial problems. 1 in 5 will end up with an additional diagnosis of clinical depression. And 1 in 6 will end up with a substance abuse issue. Maybe that's prescription, maybe that's self-medicating. But these are concerns that all impact. I've seen sprain strain injuries that should have returned to work. And again, guidelines are uncomplicated. There's for the uncomplicated injuries, but as soon as we put time and disability and people away from the workplace, these other things start getting in the way of people having a productive return to work. So this is why we're pushing it so much. Communication is the key part of collaboration. And when you communicate and have a good relationship with your injured worker, it makes things so much smoother. I've worked with employers that I've literally had to say, be nice, sound nice, look nice. I know that there is the percentage of people that make our days very hard with return to work, and it's challenging, but it's super important. They even taught us when we were doing training, so the days that I was making decisions on claims, that actually when you have a grumpy face on the phone, they can hear the grumpy face. So all of that makes a difference about caring, feeling supported, all of that. Think about your nonverbals. Think about your tone, how you're speaking. Sometimes as a manager and or a supervisor or whatever else, you've got so many other workload issues that sometimes can influence how you're coming across. So I ask you just to pay attention to it. I did have an employer that one point, it was a construction employer. The employee stepped out of the truck, hurt his foot. The employer had a setup with a local medical clinic and whipped them off to the medical clinic. They had a well-written return to work program. They had modified duties. They made an offer of modified work and went with the employee to the doctor's office. Doctor took the employee in, slammed the door. Employee came out shortly after with a note for 2 weeks off. But they're like, wait, what? Why are they off of work? We have modified duties. Doctor wouldn't speak to them. Workers like, see you later. I got 2 weeks off. So off they went. So they're paying attention and they're doing the best they can. So they come up with another modified work offer and they send the foreman over to the worker's house. So the worker answers the door and says, what are you doing? I already told you I'm off for 2 weeks. Got a doctor's note, off for 2 weeks. And they're like, no, but we've got work. Nope, off for 2 weeks. Then the employer comes back, sends out the next day the superintendent. Then they send out the health and safety person. Then they send out the health and safety manager. They sent 5 people over the 2-week period. And by that time, the worker is so aggravated that he's got another note for 2 weeks off. So when they asked me at that time when I could get involved in claims and get in there, I was able to pick up the phone and speak to the worker. What's going on for you? Hey, how are you? And he gave me a whole earful about how terrible that employer had been to him and how awful and whatnot. And so I took a little bit of time to listen because it sounded like he was very angry. And granted, the more he shared, it was like, oh, wow, interesting. So we finally got past all of his grievances. And it was like, so tell me more. They've got some really light duties. You're going to be seated. You're going to be able to review blueprints. What's going on with this? How come this is not working for you? And he said, well, hey, they've actually given me duties in a place where I need to wear steel-toed boots. I'm in an air cast boot. I can't put my steel-toed boots on. What? You're in an air cast boot? Okay, nowhere does it say that. They didn't tell me that. And I'm on crutches. I'm not allowed to weight bear. What? And they put me at a segment of the construction site that is an hour and a half drive away. It's my right foot. I can't drive. And it's like, really? Okay, let me get back to you. So when I spoke to the employer in all of those times, not once did they say, how are you? How are you doing? What's not working for you? What can I do for you to make this work? When they finally understood, and they kind of made a joke about it from going on because I had a long-term relationship with that employer, it became, yes, I know, I need to be nice. And as much as it sounds like a bit of a joke, it really seriously impacted that duration of that claim. That particular person, it was so contentious that they were off for almost 2 full months. And finally, at that point, we were able to get them to talk and make some decisions and make the hard decision to finally end wage loss because the duties were appropriate and they were offered kindly and we were able to make that decision. But it was needlessly put off and needlessly long. So we don't want any more of those situations, especially with the Bill 41. We want to make sure that things are working for, and again, like I said, Teresa will talk to it. So ask them what you can do to help. Ask them what they feel they can do. If an employee feels that they're part of their own return to work planning and identifying modified duties, they're way more likely to participate with you. Ask them to follow up with you. You may be busy. You don't need to hunt them down. Communication, it's about the quality, not the quantity. We got to do an audit of somebody's, another employer's return to work program. And when I asked about communication, oh yeah, we always talked about our employees. We always talk to our employees. We talk to them regularly. Well, what does regularly mean? Well, we usually text them every day or twice a day. What? How's that going to be helpful if they've got a broken leg? They're not going to be better in 4 hours. So it's the quality and the kindness of the communication, not the quantity. More is not better in this situation. And it's also ensure that you're setting program expectations. This is what's going to happen next. This is what I'm going to expect you to bring back to us. This is what we're going to look forward to. And we're going to talk again next week, if they're not back at work, about return to work. Do not imply that their job is at risk. It doesn't really bode for buy-in for return to work when you're threatening people and their pay. Don't repeatedly phone and text. Ask us for help. So if you've managed to keep somebody connected and it's going sideways, or you're having struggles with getting somebody in the workplace, come to us, get to us, make sure you're using the portal and you are using the whenever possible to submit all of this documentation and your requests for us to help you. And the next thing is always, make sure that you're not asking for, oops, I've gone too far. Make sure you're not asking for information you're not entitled to. There are only 3 things as an employer that you need to know. You don't need to know anything else, and you don't want to. You need to be able to know the area of injury. What part of the body? Is it the nose? Is it the ear? Is it the elbow? What is it? So you can make that accommodation. You need to know what abilities they have. They should do this. They might not need to do that. And you also are allowed to know prognosis. And that's not prognosis in the recovery and the disease process. Oh, how long do you got to live? That's not what we're talking about. It's prognosis with regards to return to work. How long until they come back into the workplace? How long should they have modified work for? Those are the prognosis questions that you're entitled to know. So if you keep it tight, it's much easier for you guys to make the decisions and not get the extra information that's going to complicate things. Are there any questions so far? Cool. I'll keep going. So we want to collaborate to prevent disability. Make sure, just some key points, include the supervisors, include the employee in return to work planning, communicate with genuine care, be nice, look nice, act nice, consider the employee's unique factors. No 2 people recover in the same way. My shoulder is not the same as your shoulder because what's going on may be completely different. And the most important piece, which leads us into the early active rehab, is refer the worker to physiotherapy and early active rehab. That's part of the collaboration, the communication group. When you send somebody to physio, and that's physio is what we're really looking for, it allows for the physiotherapist to give you more information to enhance that return to work or look for opportunities and support your return to work efforts. That keeping people connected. They also have information to help you choose what are the right duties to be assigning this person. How do I make them suitable? Some of the benefits, if for workers, if they get into physio early, early active rehab means early recovery, better recovery outcomes. The other thing is when somebody gets into the physio, even one visit gives them an opportunity to learn some education about how to manage pain and some stretches and strengthening. They also help physios that are geared, and I'll talk a little bit about some of the options. So for you, some of the employers that you guys are, that I know you have good return to work programs, you're perfect position to look at are what we call early access to physio. And I'll get to that into a slide or 2. And that is a system that can help set up keeping people connected whenever possible to the workplace because the physio knows their business. For employers, it helps in the need is time loss, there's engagement. It looks like you're helping somebody get recovery, helping them to access and navigate the system to get what's best for them. If you're offering or even educating them on physiotherapy, and it helps with guiding return to work planning for you. In all, I don't know if you know this, but in all claims, all pending claims, the worker is entitled to 1 physio visit. That 1 physio visit is gold. And by advising an injured worker at the time of injury that, hey, you just need a claim number. Did you know you can go to the physio? It's no cost. It's billed to the claim. They get the 1 visit and that opportunity for education, strengthening, all of those things.
Elise?
Yes?
Hi, there's a question
Sure.
that I wanted to put forward. What are some of the strategies that HR/return to work coordinators can use to ensure our due diligence concerning medication in safety sensitive environments?
So this is a situation where you need to have, when you have a safety sensitive position, that you are maybe entitled to a little bit more, and that may be time for information to be added to your functional abilities form, especially going out. Sometimes standard functional abilities form, when you're looking for, whether it be from the physio, whether it be from the doctor, we prefer physio over doctor because of that active rehab piece. you may want a section on that, like a quick section, because we recommend nothing more than 1 page. As it's a safety sensitive position. Are they on any medications that could impact that? Those are the kind of things. I don't think you're entitled to know what medications they're on. Actually, I know you're not, but it's absolutely okay to ask those questions. So I don't know if that's going to help. When I did disability management for another employer, and that was my role to ask those questions, quite often we did things individually and individual asks, because it didn't apply for everybody all the time. And so one of the things that we did was we did start making those asks of the healthcare provider specific to that job, to that worker, to that injury. That help? I can't see anybody, so. Okay, come back to me if you feel that you need me to expand on that. Teresa, do you have anything to add to that?
I don't, Elise. I think you covered that well.
Okay, cool. All right. So standard physiotherapy, that is our standard contract for all claims. That's allowed on all sprain strain type claims. And you don't need a diagnosis of sprain strain in order to access the physio. They can go. They don't need a doctor's referral. They can go right away. It's covered under the pending claim. That's how jazzed we are about early active rehab, is we'll even make sure it gets covered on the claim, even if the claim is allowed in the end. They get the 1 visit. Again, there is no referral needed. WorkSafeBC doesn't have to approve it. They just need a claim number. Now, for those that have more, so we want to make sure that there's opportunities for people that are working on their return to work programs and getting it into place. And when you do have a good, robust return to work program, we have something called early access to physio. And what that is it's designed to enhance and support return to work with providers, physiotherapy providers. We have a list of contracted providers that are a part of this network. We have some links on WorkSafeBC.com that we can share with you. But really the goal of this is people, when you have that relationship with a physiotherapy clinic, and we usually recommend a physiotherapy clinic that's near your work location, so it's easy access, you can oversee it, but they're expected when they enter into an agreement with an employer that they are seen and assessed within 72 hours of the referral. Sometimes that is way faster. If you're in a smaller community, sometimes it takes weeks to get into the physio. So that's one of the agreements. You get an assessment within 72 hours. It is meant for injuries, sprain strain type injuries that happen recently. We don't want long-term injuries like, oh, my back has been sore for 10 months now. That's not what we're looking for. There's a high likelihood of a long duration, long decision-making process. It's it's adjudicated under the Act a little bit differently. We want the stuff for that's a recent injury. The assessment is expected from the physiotherapist within 72 hours. Within another 24 hours, they're expected to give you a functional abilities form. Now, this is not your functional abilities form. It's part of the program. There's a functional abilities form that the physio will complete, either send to you directly or give back to the worker to give to you, so you can start return to work planning as soon as possible. And finally, when a claim is allowed, and backing that up, when the claim is pending, the difference between the two is there's that one initial one, like all claims have, plus 3 more. So there's a total of 4 visits. And the purpose of that is continuity of care. So if somebody comes in this week, they continue while we make the decisions on the claim to see still continue to get support from the physiotherapist. So, and then the final piece is when the claim is allowed, there's an opportunity to have the physio or billing codes to the claim for the physio to come to your job site and help with return to work planning, especially in those situations where return to work is going sideways. This is a really great program. There's been lots of benefits from it, from what we've seen. In what we've pretty much noticed in our numbers is when there's just the standard contracted WorkSafeBC claims underway, early access to physio actually cuts the duration of treatment. So the number of days where people require physio treatment cuts them in half. And it also cuts in half the number of physio visits. So that decreases claims cost. Overall, what that all means is decreases claims cost. It's 50% more effective than just going along in the regular way. So again, this is something that's available for all employers. that have good and robust, and the information is on WorkSafeBC.com. So how do you get started? The link there, we have a phone number that you can all phone. We have an email address, and it's on WorkSafeBC.com under the employer section. You need to complete a self-assessment. That's just making sure you have the right pieces in place. It's not going to be helpful to have a new physio contract if the right pieces are not in place. So you fill out a self-assessment, email it to us, and you pick a physiotherapist from the list. So on the website, there's the list of active providers that do early access to physio. And you pick your physio, you connect with the physio and set up that relationship. And then you send everything to us, to WorkSafeBC. There is really no approval. It's when all the pieces are put together, we can then go forward and start allowing payments on claims for the on-site coaching, the functional abilities forms, all of those things. Any questions on early access to physio? Okay, I see I'm right on 30 minutes, and I'm now going to hand it over to Teresa.
Hello again, everybody. Let's talk about Bill 41. There's quite a lot of information going out that has already been spoken about Bill 41, and we want to give you some of the basic principles and also give you opportunity to learn more in a webinar that's coming up soon. So Bill 41 provides a legal framework to all the things that we have been saying in the past, everything that Elise has talked about up until this point. It provides a legal framework. So it provides accountability to the employer, to the worker, and to WorkSafeBC in the return to work process. Bill 41 becomes active January 1st, 2024. However, it received royal assent in November 2022, so there are portions of it that can be retroactive up to 2 years. We have a compliance department that's figuring out how much and what portions will be retroactive, but stay tuned for more information. So the basic applications of Bill 41 is the duty to cooperate and the duty to maintain employment. This applies to injuries, mental disorders, and occupational diseases, and it applies when the worker is disabled from earning their full wages at the time of work, and not only their full wages, but they are unable to do the essential duties of their job as well. Next slide, please, Elise. Oh, sorry. I forgot about the the slide adds more information. So the duty to cooperate is for employers and injury employers, workers and injury employers. So it applies to everybody, all employers. The duty to maintain employment only applies if you regularly employ 20 or more employees, and if that worker has worked for a continuous 12 months. So it doesn't apply if someone has only been working for 6 months. However, we do hope that you will apply it, but we can't hold any accountability if someone has only been there for a few months. And also, if you have less than 20 employers, we still hope that you will keep portions of the duty to maintain employment, but it does not apply, and there is no legal accountability if you have less than 20 employees. Next slide, please. So these are the main components: the duty to cooperate, that's that DTC you saw a little earlier, and the duty to maintain employment, the DTME, and then the consequences is the accountability piece that we're talking about as far as non-compliance. Let's get into it. Next slide, please, Elise. Okay, so first, the duty to cooperate. Again, it adds a legal duty to the workers and employers to cooperate. What the duty to cooperate piece under Bill 41 says is that the employer and the worker should be in contact at the most practical moment. So I used to be a VR at WorkSafeBC, and I am the last stop. If WorkSafeBC was the train, I was the caboose. I was the last place that the claim was going to go. And this meant that the person was not going to go back to work in any form or fashion because there was no position available that they could physically do. When I contact the employer and say, hey, what is your employer saying? When I contact the worker and say, what is your employer saying about your ability to return to work? Do they have anything that you can do? The typical answer is, I haven't heard from them. Now, by the time a claim gets back to WorkSafeBC, back down to Voc Rehab, that can be anywhere from 3 months to a year. So for someone to not have heard from their employer, from them, it leaves the worker feeling like that there's this lack of care, that there's this that they may not want them back. It leaves all kinds of feelings, and it makes it more difficult to reconnect that employer back to the worker, back to the employer. What a lot of times employers have waited up until now to hear from WorkSafeBC, to hear what the abilities the person has and what their functional abilities are and those type of things. They usually wait, that waiting game slide that Elise talked about prior. But now we're asking that communication is made immediately, that immediately as soon as possible. Like if the person's in the hospital, we don't expect you to call, we actually caution you not to call them. But if the person is at home, they have a sprain, they have a strain, you should be in contact with them right away. For the worker, they also have a duty to maintain contact. They should be letting you know, that, it is advised that I don't do this or that. It is advised that I don't come back for a week. It is advised, so that you know what you can offer and what types of positions may be available for this person. It should be a collaboration between the employer and between the worker. And on the part of WorkSafeBC, we have hired return to work planners. We are responsible for facilitating communication and also for making sure that there are timely interventions and resolutions to any disputes that are going on between either party. Next slide. Now, the other portion there, the large portion when it comes to return to work, is the duty to maintain employment. Again, this was the one that had the requirements of you have to have 20 or more employees, and the person should have been working there for 12 continuous months. Elise, I'm not seeing a slide there. Okay, got it. The employer, the responsibility under maintaining employment is to offer and provide sustainable work. It should be meaningful work that is within the worker's abilities and to accommodate the worker to the point of undue hardship. So your duty to maintain employment ends if it becomes an excessive amount, if it becomes an excessive fee, an excessive inconvenience in order to put the person back. So that there needs to be communication between the employer and WorkSafeBC if those things are seen, so that we can advise. And for the worker, their responsibilities is to update the employer on their abilities, what they can and can't do. A lot of times the worker is well positioned to see what positions are available and to say, I can do that position there. Or they may have other skills and abilities that you're not aware of. So they should be communicating and they should be participating to help identify what is suitable. Again, we're looking for that collaboration between the employer and between the worker, where they are communicating and deciding, is there something that is suitable? Is there something that I can do? Is there something that is available that would restore me to my full wages? And for WorkSafeBC, our commitment is to help with the functional abilities through assessments, supporting physio, and also to help resolve disputes. And I believe we have a question in the chat. Let's see.
How about I'll read it out for you?
Ooh. Okay, it's long.
It's very long. Okay, from David, question. When we get to discussing it in this presentation, here is a challenge that we often face that would be helpful for a strategy to address. Sometimes an employee will become injured at work, and we will have the employee bring our injury management workbook to the medical practitioner with functional restrictions evaluation to be completed by the doctor so that we can align it with our modified alternate duties that avoid impacting the restrictions. Occasionally, we will receive back restrictions evaluation from the doctor that states the employee is not approved to do any body movement and in fact indicate that they may not return to work at all. The frustrating part of this is that the nature of injury is often relatively minor, like a sore shoulder or a strained ankle, and the restrictions mirror that one would expect of an employee who is nursing injuries who ought to be hospitalized and not what will happen in their home. The employee will be bolstered by this doctor's response to and refuse modified alternate work. And by the time WorkSafeBC comes to a claims decision, the claim is being denied, results in the employee being out of pocket or WorkSafeBC having to pay wages for an injury the employer could have had the employee working. What can we do to fast track these situations so that the employers can effectively carry out a safe return to work process for the employees?
That is such a good question. Thank you so much for posing that. And you're absolutely right that these things do indeed happen. What we can do, the first steps for me would be is that you want to document, like in your F7 report, when you're reporting that injury, you want to document any conversations you have with the worker as far as modified work or suitable work or alternate work is concerned. You want to put that in there as soon as possible. A lot of times, if you would go to your employer report card and look up and pull that information up, you can see the majority type of injuries you have. A lot of jobs have very similar types of injuries and very similar people who are getting injured. So you can kind of look at those and start to create modified jobs that would accommodate the people who are injured. So if someone is typical, if a knee injury is typical in your line of work, or if a arm, an arm injury lifting is typical, you can have a source of modified jobs already built up. But in the case of that worker, once you figure out, once you look at the information, regardless of if you know that they say they can't move their arm, but you have a job where they don't have to, or that they can't stand and you have a seated job, you need to upload that modified job to the portal and make it available on the claim, because WorkSafeBC can't make a decision and can't get involved if we don't know that there was a conversation, modified work was offered, we believe that is suitable, upload it to the claim on the portal. When you upload something on a claim to the portal, a message is sent to the claim owner and it will be actioned on quicker than if you wait for them to call, or if you're calling and trying to explain what's going on. So you want to get ahead of it as much as possible. A lot of times there are things that happen where people are still getting wages, or where it does take time to adjudicate, but you can cut down a lot of the time and a lot of the claims costs by making sure that when you're having the conversations, that you're documenting the conversations, that you're providing modified work, and you can provide more than one option, and that you're uploading it to the portal. So that's what we need to see. And if that's happening, you can ask that claim owner to make a decision on that modified work that you believe is something that they can do. And once that claim owner sees that note from you in the portal and they see that information, they're going to reach out to that worker and ask them why they aren't cooperating. And if they are not cooperating, if what you are offering is reasonable, there will be consequences for that worker, and some of them may be discontinuation of their benefits. Elise, do you have anything to add to that?
I do, just as an aside, not so Bill 41-y, because that definitely, that just puts a slightly different perspective and makes it the obligation of the worker to cooperate. One of the other things that I've learned just from my own experience is to make sure that you're not asking a healthcare provider for permission for a return to work. It's changing that lens, that you are looking for their functional abilities. You're not looking for them to approve these light duties. And so what I found to be more successful, because if you got to be careful of what you ask for, because you're going to get something you don't want. So how we've always phrased it is, please let me know what their functional abilities are. I didn't ask you what job duties they can do, and I'm not providing you. You as the employer, you as the manager, you are the specialist in what jobs are available, what they look like, how it's going to work and fit together. Between you and the injured worker, that collaboration is the determining factor for the duties. The only thing that the doctor or and that's why we want to shift. Healthcare provider doesn't always mean you just got to go to a doctor. It means that you can go to the physio, and we want to ask for those functional abilities, not their opinion on the duties. They don't know the duties. That's where early active rehab with the early access to physio that can give you the support that you need from the physiotherapist. Because if you have something that the physiotherapist has supported you in early with that modified work offer, that gets great evidence to making sure that this, the conversation goes that injured worker, why are you not working? And when the doctor knows that they've already been to the physio and the physio says A, B, and C, doctors don't do functional abilities. What they do is they say, do you think you can do it? Okay, no, you can't, you're off. So it gives a lot that the doctor can, something that they can lean on to. So I would strongly encourage you to really take a look at what you're asking the healthcare provider to comment on. So it's one thing to go, FYI, next time you go to your doctor, injured worker, take this return to work plan as information only. But you're not asking for permission. You're asking for what they should give, functional abilities.
Thanks, Elise. Looks like we have another question. Is WorkSafe having, oops, I missed it. Sorry. Is WorkSafe having conversations with healthcare providers regarding this bill? We send the functional abilities form to the doctors and we get blank page and unable to work for 1 week in the comment box. This frustrates the system that we are trying to streamline. In a one word, absolutely. Yes, we are. We have a healthcare programs and we have doctors on staff that are reaching out to doctors because they can be a significant stumbling block. It is better for a worker to be connected with their employer. And by them just signing off, go ahead, have 2 weeks off, they are not facilitating that, and it is causing harm to the worker. So absolutely, yes, we are. And it looks like there's a follow-up question from David. Thank you. So I don't ask the MP's permission for return to work, ask for restrictions, identify the modified alternative offers to the employees, and upload it to the portal. This will allow the claims manager to reach out to the employee to support the employer's safe job offer and outline consequences should the employer still refuse. In a word, yes. We also want to start looking at changing the culture of disability in our workplaces. So our system here at NBC is overburdened. It is wonderful to have free healthcare, but that comes at a cost of time. So we want to make sure that you as an employer are starting to support physiotherapy. Even if it's not the early access to physio, we're going to give you 1 free physio visit if you call teleclaims, even if your claim is pending. What that does is that gives you the ability to go ahead and get that abilities form completed and to make that modified job offer. Start encouraging that practice. It may take time before people are reaching for it because everybody's used to just calling their doctor and it taking a week or 2 to get in, but start encouraging the practice of people reaching out to physio and going into physio. You can encourage that. And some people don't know they have the option. A lot of workers would love to be tested, would love to see what they can and can't do. And so giving them that option will begin to start to change the culture of disability at your employer. Thank you for your questions. Elise, if you could go to the next slide.
Sure. Oops. Hang on. There.
Okay, so the consequences of non-compliance. So now there is a legal authority to oppose administrative penalties. Really, this is the only different thing that we are talking about. Everything else, we're providing accountability. We are applying different penalties, and this comes for the employer administrative penalties. For the employer if they fail to cooperate or maintain employment. That's why it's important to use the portal so that you can make sure that you are documenting what you're doing, and that's easy to see. And for the workers, you're not going to just be on benefits excessively until, and saying no to every offer until we can finally figure out what's going on. That's not going to be the case. And it's up to us to adjudicate the failure to comply and determine and impose penalty amounts. And, there's always an appeals process. So we don't always, there are checks and balances for all of us, and we are all accountable in the consequences portion. I believe there's another question.
It's a comment. It says,
okay.
we live in, and it's a good one. We live in a small northern community, and the physiotherapist here has been amazingly helpful at getting our employees in within a few days so that we can work with the limitations if possible.
Thank you so much for that comment, Charlene. That is so important. And another thing that raises another point that we didn't discuss, wherever you are, whether you're in a small town or whether you're in a large town, if there's a few physiotherapies down the street within a few kilometers of your job, you can go down and ask them, hey, we'd really like to send our workers here. Is it possible you could get them in, or, give a special preference within a day or two? A lot of times the answer is yes. And that's why we suggest that the answer is yes. They will get your employers in. They can have copies of your modified work so they can test someone and say, yes, this person can go to this position, so you can develop a relationship with physiotherapy. I recommend a couple so that way it doesn't look like there's any type of preference or favoritism going on, and the worker can choose, but you can have that conversation, and they will often accommodate you. Another question here, when you refer to physiotherapy, does this, sorry, the screen jumped so fast. Does this also include athletic therapy, as this is common sought after treatment with shoulder, arm, and wrist RSIs? Elise, correct me if I'm wrong. I think athletic therapy is, I'm not sure who it's done by, but what we want is treatment that is done by a physiotherapist, because they're the ones who can outline those limitations or restrictions. If the athletic therapy, and I think that's done by a kin and not a physiotherapist, if athletic therapy is done by a physiotherapist, they may be able to comment on the functional abilities, but you want to highlight the physiotherapy and not the athletic therapy, only because you want that comment on the abilities.
It's physiotherapy is what's recognized by WorkSafeBC at this time. And that's my understanding is exactly that. If it's overseen by a physiotherapist and maybe performed by a kin, that's fine, but it has to fall within the parameters of physiotherapy.
Yes, thank you. And Barbara says here that we too have access to physio and they come to the site monthly. That's fantastic. We use them for work and non-work related issues, and in between visits, we use video visits with them. This is phenomenal. I'm glad you guys are putting this out in the chat, because there are some things that we don't always think of, and this is a great option. And it just shows your commitment of helping people return back to work and getting people back to work. That's phenomenal. Ben says here, we have physiotherapists on site each week to assist with this process. It has been incredibly supportive to our gradual return to work process for our facilities. We're absolutely glad to hear that. That is phenomenal. And that's the kind of communication we want to start having with physiotherapists so that people can get to work faster, get to physio way before you can even make a doctor's appointment.
Just to add, because going back to the sort of what happens when the doctor sort of writes them off or there's no response, this is the value of the physiotherapist and the documentation that comes. Quite often we are only as good as the documentation that comes to us. And we recommend, of course, using the portal, but send us all of those bits. If you get a random weird note that says off work and there's no information, it really sets up the story well for the adjudicator to make the decision. Look, the physio are saying these functional abilities. Look, the doctor says absolutely nothing. That helps them make those sort of hard decisions and look at, why is the doctor saying that? What medical indications are there in the background? And they can investigate that kind of stuff. But often you guys have the information before we even do. We have certain WorkSafeBC forms. For example, the physiotherapy form that they fill out for us is 7 pages long. And it takes up to a week. So you may have information way faster that either supports return to work or sets up that discrepancy that you want us to look at. Please feel free to send everything in through the portal, upload and scan and send.
Yes. Next slide, please, Elise. And thank you for that information. Okay, so Elise and our particular department is consultation and education. We work with employers. We take a peek at the disability management programs. We pull stats and data from our sources to help identify problems and issues. And we want to make sure that you have access to all the things you need to help with your disability management program. So on WorkSafeBC.com, you're going to find information on recovery, on keeping an employer there. You're going to find Bill 41 information. All the stuff I discussed today, if you need to read that definition again for duty to cooperate or duty to maintain employment, all of that is online and it is available to you. We also have guides and templates that are going to help with your modified job offers. That's going to help with, so you have that form that you can upload to the portal. That's going to give you, and we are perfectly happy if you plagiarize. Literally just put your company stamp on top of our forms. We're fine with that. So if you see a document in there that you like, take it. Take it and use it. It is for you to use and to guide your return to work process. We also have information sheets to help with creating that modified job offer, knowing how injuries affect different types and different parts of the body so that you can come up with suitable work for your workers. Next slide, please. And in return to work consultation and education service, we have a slew of opportunities that we provide. Elise talked a little bit about our early access to physio. We also offer return to work coordinator courses, supervisor courses, and training. A lot of it talks about how to properly fill out that F7 form, how to make sure everything is attached and uploaded. We do engagements to help where we partner with employers to help reduce the duration of your claims and the amount that you're paying to WorkSafeBC and to reduce those rates over the next 4 or 5 years. We have short-term interventions. And then if you just have a question, it may feel simple or whatever, but you just want to discuss it with somebody, we have a phone line where someone will call you back within 24 hours with an answer to your question. We have an email address where you can send an email, and someone is always monitoring the phone line and the email address. Next slide, please. And if you want more information on Bill 41, if this was just a teaser, you would like more answers to questions, or you just want to remain in the loop on how it's on what's going forward with it, because to be honest, it's also very new. We haven't actually seen it applied yet. We haven't actually seen how it's going to be adjudicated and how it's going to be used. We are having a webinar on November 16th from 3 p.m. to 4 p.m. That QR code there will lead you to the registration page so that you can register and participate in the Bill 41 employer information session. So this will give you more information, may discuss points that I didn't touch on today. It's a really chunky bill. There's so much in it. So I really recommend that you attend this session, because what we went over today were just the highlights of it. It may give you more information that you find valuable and that will help you as well.
There's a new question, and it's perfect for you.
Let's see.
From Willow.
I am curious if there are any resources for people specifically dealing with mental health claims you could provide us with. Soon. But yes, right now we are suggesting that mental health is not excluded under Bill 41. And a lot of times we know that, employers have been hesitant to contact people who have mental health claims because it's sensitive and it's difficult and it's complicated. But we are asking that you still reach out to the employer and call the employer, that you still treat the claim the same way. You ask the person what they can and can't do. You try to get as to the functional abilities, you try to see what mental health abilities that you can ascertain from their medical professional, and that you treat that claim exactly the same way as you would a trauma claim. We are developing, and they should be approved within the next few months. Feel free to reach out to me. My information will be included in the next slide, but we are completing and having resources that are literally in the pipeline right now that should be out in the first quarter of next year. So there will be some resources in that toolkit and online that you can pull to help you to manage those mental health claims. In the meantime, if you are hitting a stumbling block and you just don't know how to move that claim forward, please call our phone line, and they will give you the assistance and the help that you need. Please reach out to me. I would love to give you the help and the assistance that you need. Will the employer forum on November 16th be recorded? Yes, sorry, Elise, you got it.
Oh, Barbara's already registered.
And
Excellent.
wonderful, Willow. Please reach out. Absolutely. Absolutely reach out. Next slide, Elise.
Ta-da.
So if you have any more questions, I do believe we have some time to field a few more questions, but that's my information. That's Elisa's information. Would love to hear from you. It is okay if you just want to call and say hi. I love to talk to people and I love to say hello. And if you have any questions, definitely reach out and we will do the best that we can to contact you and to reach out to you. And also the claims line that the return to work support line that we have is an ongoing resource that you can have, that you can always call and get answers to your questions. If there are no more questions
out there.
No more questions?
Yes. We sent it. Tammy has a copy.
Yes.
So I just wanted to let both of you know, Teresa and Elise, that I already sent a note to Tammy that we will be sending out that presentation on November 16th to everybody that we normally send stuff out. So they should be getting a copy of that too.
Fantastic. Thank you so much, Bill. We appreciate that support. And we're here for any conversations or any follow-up discussions that need to be had around Bill 41.
So if there's no questions from anybody, I want to thank both Teresa and Elise for the great presentation. I guess we lucked out in that we also got the bill information added to the presentation, which is really good because it is a topic that is new, and I think everybody's been sort of scratching their head as to what does this really mean. So thanks for that. I think it's important to get this type of information out as quickly as we can to the employers so that they can facilitate better return to work. And the information you both provided is really going to help that. So, and I encourage everybody to take up Teresa and Elisa's where they said, give them a call, say hi, there's nothing better than having a good relationship with people like Teresa and Elise where they can help get you over those little bumps in the road that you all face with your trying to keep your injured workers gainfully employed and working whenever they can. So they can go a long way to help in that process. So thank you both, Teresa and Elise and Tammy, for setting all this up. It was great to see this take place.
Thank you so much for having us.
Thank you so much. Appreciate it.
Okay, thanks for coming, everybody.